name is Julius Kalima, nephrology nurse. We also call ourselves renal nurses. This is part of nursing, but it's a specialty in nursing whereby you specialize with dealing with patients that have issues with the kidney. We normally call that one ESRD, end-stage renal disease. That's to mean that this patient is not able, the kidney is not working, not able to remove toxins from the body, and again not able to remove fluids, meaning that that patient retains all the fluid, including water. Some of them do not get urine, others get very minimal urine. So once you do a test in the blood, you'll be able now to get all the toxins that are removed by the kidney. And again, once you examine the patient, you'll be able to see they have fluids in their body. They can have puffy eyes. They can have a wet chest. You'll realize they have a frothy cough, meaning that they have water in the fluid in the chest. Sometimes when you examine them, you do a physical exam, you look at their lower extremities. They'll have edema. They'll have increased weight. Then with the toxins, you will realize they'll have low appetite. We call that one anorexia because of the urea. Because the urea is very high in the body. Again, they will have low blood. That is, they will be anemic. The reason being, they have a lot of urea in the body, such a way that there is now absorption of iron in their body. Again, the kidney normally produces an hormone, we call it erythropoietin. The kidney produces 90%, the liver produces 10%. Now, these kidneys have issues. Because when you realize the patient has issues with their kidney, there is the two kidneys.
Okay.
Someone might have one issue with the kidney. We might have issue with one kidney, and you might not realize because the other kidney is enough to do all the work that is done by both the kidneys. So when someone has been diagnosed with issues of the kidney, it means that it is both kidneys. That's why you'll see someone being transplanted with one kidney, and the one that has donated, they remain with one kidney, and they are able to function well. The one that has been given one kidney, they'll be able to function well, meaning that one kidney is enough. So when someone has issue with the kidney, it's both kidneys. So how I found myself here, this is where my passion is. I really wanted to be a renal nurse or a nephrology nurse, because I really feel that that's a place, or that's one of the areas where your impact will be seen immediately, because you meet a patient that is has a complication, maybe a patient that has issues with hyperkalemia, a patient that has issue with their chest has fluid, and immediately you dialyze that patient, you will be able to see instant results. Because if it's hyperkalemia, the patient will be able now to recover immediately. If it's fluid in the chest, you'll be able to remove that fluid, and within that session, one session takes 4 hours. So within those 4 hours, if the patient came in with a wheelchair, they will move out walking, meaning that you will see instant results. So it's where my passion is, and it's where I feel actually I've delivered the service to the patient, and I go home satisfied. Yes. At the time, I was called at 2 a.m. There was a patient that had issue with their chest. So that time I was told immediately to come, because the patient actually needed dialysis. And I came. It was at 2 a.m. I made home my way from Kasarani sub-county to here, Stare. Now, I came from the patient in casualty. The patient was brought in. The patient was actually in coma. Was not able to speak, could not understand themselves. So we did a session for 4 hours. By the time we were done at 6 a.m., the patient was talking. The patient was alert, could realize that the place they found themselves, the place they had left themselves, they found themselves in the hospital. And the patient was so much satisfied. So that's one case that I feel actually I did my best. and I could see the results immediately. So it was to my satisfaction that I've saved a life. This is someone that was in coma, and within 4 hours of dialysis, we were able now to get the patient out. Today the patient is alive, walks in dialysis, does dialysis on Tuesday and Friday, and the patient is fine. I think there is a very big gap in making a diagnosis. Sometimes there is a lot of delay that we as nurses tend to take. We tend to take a lot of time, such a point that when we are coming to diagnose the condition, it has already worsened the state of the patient. Like the blood pressures and the diabetes, because now those are the major causes of end-stage renal disease. Diabetes causing 36%, pressure causing 30%. Now, if those cases can be handled as early, if these cases can be diagnosed early and they get to be managed, we will not get to such a point that a patient now will have to do a dialysis. Because now dialysis, this one is a lifetime thing. This is a lifetime thing. The patients are not coming out of dialysis unless someone is transplanted. Meaning that the initial stage is where the patient had issue with diabetes and hypertension. If it was settled, if it was handled, we will not come to this state that the patient has to do dialysis for the rest of their life. So I think we as nurses, we need to be so much vigilant in advocating for drug adherence, in advocating for patient checkup back to back, because now that is where the issue is. Because if we are not able to advise our patients now to have drug adherence, if someone is not taking their drugs well, meaning that this is where they will end. If they were able to control their diabetes, their hypertension, if they were able now to come for checkup, frequent checkups, they will not come to this. Meaning that we need to talk to them more, we need to advocate for checkup, drug adherence, we need to advocate for change of lifestyle, because those are the things that are causing all these issues. So I think that's one thing that we as nurses, we need to work on, and we'll be able now we will have now helped these patients. I think that's an assumption, because when you say you don't have a life, it's always good when you are handling a patient and you are adding them one more day. You forget about your life, you handle this patient, and you earn them one more day, one single day. It is so much important. So we cannot say that we don't have a life, because it's sort of about strategizing your services. How long are you going to handle these patients? How long are you going to, how are you planning your work? Because like me, I normally arrive here at 5 a.m. in the morning, and by 3 p.m. I'm done. Unless there is an emergency, that's when I'll extend. But by 3 p.m. I'm done until tomorrow again at 5 a.m. You see, now, like that means that the time that I'll spend here in the hospital is like 10 hours. The rest of 14 hours, that's where my life is. That's where my life is. But when someone is passionate about this, they can't complain, because now that's where you get satisfaction. I think here at the health gate, right now we have 17 patients. 17 patients. Every patient doing 2 sessions per week. And none of our patients has ever complained, none of our patients has ever missed dialysis, none of our patients has ever gone home without getting the service. So here at Healthgate, we have enough machines, and we have enough space for every patient. Everyone that comes to our place, they'll actually get dialysis, they'll get the service. This is because we have several nurses that are able to do this. Me personally, I'm a renal nurse. We have another renal nurse, and we can work with the shifts, meaning that we can, because now one session takes 4 hours, and we have 4 machines, meaning that we can, the first 4 hours from 5 in the morning to 10 in the morning, we can handle 4 patients. From there, we can handle another 4 patients up to 3 p.m. From 3 p.m., we can handle another 4 patients up to around 8 p.m., meaning that we have enough space for our patients. And again, at Healthgate, no one will ever get their service delayed, because every time they arrive at their scheduled time, they will find that the machine is ready, the bed is ready, and we are ready. Their plan is already in place. So we would encourage people from Isili and its environments, and even in Nairobi, that are willing to get the best care in terms of dialysis. Healthgate is the place. So they are all they are welcome. Let them.